Hi everyone, this is Swabra Swale.
I'm Flavia.
I'm from Gynageeks,
Kenya.
And today we shall be talking about fibroids. We have heard so much about them. Some true, some not so true.
Very popular topic.
Very popular topic. Very popular and common.
The common presentation in the clinic.
Exactly. And Flavia, maybe tell us what are fibroids?
Okay, fibroids are benign growths in the uterus. They could occur inside the uterus, within the wall of the uterus, or on the outside of the uterus. So now we'll talk about the risk factors of fibroids. So some of them are age. So the older the lady is, the more likely she is to have fibroids. So a lot of women over 35 tend to have uterine fibroids. Another risk factor is black population as opposed to the other racial groups. And obesity. So the bigger you are, the higher risk you have of.
Maybe to also add on that, family history of fibroids, usually if your aunt, your mother had fibroids, more likely you're going to have fibroids. Nulliparity, and this is where some women choose not to have children, but that increases your risks of having fibroids. And finally, menses. And menses here, then I'm going to clarify, there is the lady who started her periods a little bit way early, and the lady who has hit menopause a little bit way later. So that exposed period to your menses and estrogen predisposes you to fibroids. Yeah. Exactly. Okay. And so today we're going to talk about the signs and symptoms of fibroids. How does a woman with fibroids present to the doctor, to the clinic, or how do you feel about them? I'll talk about pressure symptoms. This is not quite so common, but the bigger they grow, the more likely they are to compress on surrounding structures. And so it could be your kidneys, it could be your ureter, it could be, so you most likely feel like you want to pee all the time, you want to poo all the time, simply because it's taking up space. Number two,
common
maybe you can
symptoms.
go about,
So common symptoms are heavy periods. So that's what mainly brings a patient to the hospital. So she'll be having a really heavy flow in terms of the number of pads she's changing or the number of days that she's bleeding. She may also come with really severe cramps. So she'll notice that the pain during her menses is just becoming unbearable.
And then maybe also infertility, because depending on where they are placed, located, how big they are they blocking the tubes? Are they preventing implantation? So a woman may come in struggling to conceive.
So now we want to discuss about the management. So what do? You come to the clinic, we diagnose you with fibroids. So what next? So one, there's the option of doing nothing. So it depends. If you don't have any symptoms, and yes, you have fibroids, we can leave them alone. We just monitor. Monitor the size, monitor the symptoms. Another option is medical. So we manage the symptoms as they present themselves. So if you have the heavy periods, we manage the heaviness of the flow. We may give you blood boosters to try and boost your blood level. We manage the pain. So we just manage them as you present.
And maybe surgical can be considered where medical management fails, or if the size of the fibroids becomes much bigger. And so there are several options. Option number one would be take out the fibroid itself, meaning this is a woman who still wants her uterus, may still want to reproduce. Or there's a woman who's almost in menopause and will say, Doctor, I don't need my uterus, please take it out. And so that means then you do a hysterectomy. Maybe just to note, they can be done as an open procedure or laparoscopy. There are newer modalities, though, to treating fibroids that may not include surgery and cutting per se. These may also include uterine artery embolization, myolysis. They are a bit new, and so maybe may not be practiced as much, but as a patient, maybe you should also advocate for yourself.
So you may have listened to our video, and based on what you've said, you may suspect that you have fibroids. So I think it would be important to seek care just to get some investigations done to find out whether you do have fibroids or not.
Exactly.